Hey everybody, welcome back to the Wiseman Method Podcast. I am your co-host, Dwight Hurst. I'm going to be joined today by Claire Wiseman. As always, we're always here to talk to you about questions about opioid dependence and treatment. We are super excited to have Dr. Michael Lowenstein, who is the Wiseman Method's medical director, is going to come on today as well. And we're going to talk about some of the physiological effects of acute withdrawal and detox, and some of the things that you really want to know about your health and your health management when it comes to starting sobriety. One of the big takeaways that you're going to get out of today's discussion is the complexity of beginning sobriety and how important it is to do that correctly. I want to make a quick statement, too, that the coronavirus outbreak we know is gripping the world right now. And I just want to take a minute to say I hope that everybody out there that's listening is safe. This can have a tremendous effect on everyone. It is a health crisis, but we in this field more than anybody know the difficulties that can be gripping those who they or their family members are in the grips of dependence or in addictive patterns or different things that can be harmful and difficult in the best of times. It's all amplified by this kind of a thing. In fact, the next recording, we're going to get together and talk about some of the things that can impact families and individuals struggling with opioid dependence during a crisis like this, when they may not have access to treatment and things like that. So we're going to be coming back to that topic a little bit more in the future. So please be safe out there and please take care of each other. For right now, please lay on back, and unless you're driving, then sit on up straight and drive ahead. But listen to this cool conversation that we're going to have, really informative conversation about physiological effects of dependence and withdrawal. And yeah, we'll go from there. No, it's exciting to be here with you. Dr. Lowenstein, it's also great to have you here today.
It's a pleasure to be here.
Well, we're going to be talking about some of the medical and physical things that we observe about opioid dependence as well as about treatment, right? And the things that people go through. Why don't we just kind of start out with that? Well, let's talk about some of the physical effects that we do see with people who've been using for a long time.
Opiates affect multiple body systems, and it becomes very evident when someone stops taking their opiates and begins to withdraw. I mean, you can see how many different body systems opiates actually have an impact on. So opiates can affect the brain and its function. It can affect neurotransmitter production. It affects hormone production. In men, you can see, or even in women, you see reduced testosterone production. It affects sleep-wake cycles. It affects gut function. Constipation is frequently a common side effect of opiate use. It affects people's appetite. You can see weight gain or weight loss. It affects energy levels. It affects people's ability, cognitive functions, ability to think. With overdosing, you see respiratory depression. So there's probably not a single body system that opiate use doesn't affect.
I know that one of the things that opioid use is famous for is that once people have started to abuse, the rush of pleasure or the high that people talk about diminishes greatly. I mean, it seems like that happens pretty quickly, right? To where all of a sudden I'm not taking it for any kind of pleasure as much anymore as I am just to avoid the nasty things that happen to me when I stop.
Yeah, so people who take opiates for chronic pain can usually maintain a certain dosage for long periods of time. People that are using it for other reasons to treat underlying issues get very tolerant to the euphoric effect from it. And for that reason, it takes an increasing larger and larger dose to maintain that effect. And at some point, the patients really almost don't even get the euphoria anymore, and they get to the point where they're just taking it to avoid being sick. Those in search of the ongoing euphoria or those effects from the opiates are the ones that are the patients that will continually use more and more and more in an attempt to maintain that.
And gosh, that gets dangerous pretty quickly.
Yes, it can, because, the risk of opiates is overdosing, respiratory depression, death. So the more opiates you use, the greater those risks become. Also, with the current drug supply that's out there, which changes every day, would think they're taking OxyContin pills or heroin, but they could be laced with fentanyl and other substances. Most people don't even know what they're taking.
Is it just the street drugs you're seeing where the fentanyl is laced in?
Yes. Increasing amounts of fentanyl in the products, whether it be the heroin that people are shooting IV or smoking, or even the oxycodone tablets that are probably coming into this country. All the people that are using or abusing are aware that this is a fact, but their dependence has become so great, or the addiction to these meds, that they're willing to take the risk of the increased risk of overdose associated with fentanyl, just to maintain the effect they're getting from the opiates and to avoid withdrawing. So even with the known additional risks, they continue to use substances laced with all kinds of things. And some of the drug tests, I've even seen tricyclic antidepressants showing up positive.
Really?
So yes, it's so we don't even know what's in the supply. And depending on which part of the country they come from, there's tends to be different amounts of fentanyl, but the people using it are usually very aware of the fact that it's stronger, but they continue to use it again to avoid being sick.
A while back, I've worked with many people with addictions, but I just remember one story someone told in a group once where they went and tried to purchase heroin, and what they ended up getting was, long story short, they didn't get any. It was fake or whatever. And when they realized that what they'd been given was not actually going to work, they just give this picture of just sitting in their car and weeping because they knew what was going to happen to them. They were right at the point where if I don't use today, I'm starting to go into withdrawals, and just sitting there, just crying, knowing that it was coming.
Yeah, they become desperate and are willing to use almost anything they can get their hands on.
Right. I think that's a really important point for us to touch on is, how many people stay on their active use to avoid withdrawal, or to because they are scared of not making through withdrawal, of how hopeless they become after they try 2, 3, 4, 5 times and they fail it. Also, there is this myth that opioid withdrawal is not dangerous. We do see patients, of tremendous high blood pressure. We see patients that go through withdrawal and dehydrate. Having a medically assisted detox where we give patients the ability to come off opioid with medical supervision should be part of, the standard treatment. As Dr. Lowenstein explained, long-term opioids, regardless of what they are, cause, a number of different issues. The ability, the choice to come off opioids should be on the table.
Yes, that's I know. We've touched on before the whole sitting in my friend's basement with a blanket wrapped around me and my knees wrapped around a bucket. Is obviously not pleasant and obviously not good, but it's also highly, highly dangerous, as Claire was just talking about. It might help to walk us through that a little bit. Like if I'm opioid dependent and I stop using, what starts happening inside my body?
So when people who are opioid dependent discontinue the use of opiate medications, they will go into withdrawal. And the reason that happens is because when you use opiates over time, your nervous system will compensate for the sedating effects by increasing certain neurotransmitter productions like noradrenaline. So when the opiates are stopped, you still have neurotransmitters being produced at increased levels. You can see elevation in blood pressure, increased heart rate, increased respiratory rate. The nausea and vomiting and diarrhea that you see can cause dehydration, can lose important nutrients such as magnesium and potassium, which can then potentially affect your heart function, inability to eat. All of these things can have a huge physiologic effect. The detox that I perform, the initial 2 to 3 days are in the hospital. And the first thing I do for patients is start an IV and hydrate them well, do blood work to look at their liver, their kidneys, their pancreas, their thyroid, their electrolyte levels, treat the nervous system with medications that prevents that huge surge of noradrenaline and keeps blood pressure and heart rate stable. It can decrease the chances of nausea and vomiting. And if any of these things do occur, it can treat them with medications by mouth or by IV to minimize the symptoms to as low as possible and to control the physiology, the blood pressure, the heart rate, the respiratory rate, all those physiologic changes that you see potentially as a result of withdrawal.
To a non-doctor here, I'm hearing this and saying, there's a lot of that I wouldn't be aware of if I'm just like sitting, going through withdrawal on my own, thinking, well, I'll be sick for a minute, but it'll be okay. Serves me right for using drugs. If I'm going through that, nobody's monitoring all those, I think, hundreds of things you just said. There's a lot there to be conscious of. It sounds like it could be very, very risky without that close monitoring.
It can. And as patients are older, or as they have underlying medical problems, they're at more risk with those dramatic physiologic changes that you see in, cold turkey unaided withdrawal. So in a hospital setting, we're able to monitor diabetes and monitor blood pressure and monitor any of the underlying medical issues that patients have in addition to their opiate dependence. Because very rarely are they just opiate dependent with no other medical issues. So you're not only managing the physiologic effects of opiate withdrawal, but you're also having to manage all of their other underlying medical issues. And as patients get older and older, the number of underlying medical conditions usually increases. Also, patients who are using opiates tend to be sedentary. So we don't really know what kind of physical condition they're in as far as heart and lungs. So it's really important to just be able to assess all of those things up front so you can be proactive rather than reactive. Once somebody comes to an emergency room dehydrated with low electrolytes and elevated blood pressure and heart rate, it's much harder to get control of them than if you're proactive.
Patients that are 50, 60, 65 years old in rehab without the proper medical assistance to go through withdrawal. We have seen a lot of patients coming in. It's a blessing that they walk into a hospital withdrawal because they wouldn't have lasted a day or two trying to do it at home.
Yeah, so we've managed to identify in the last few years patients with metastatic lung cancer that didn't know they were sick, severe cardiovascular disease. Anybody over the age of 41, I actually the cardiologist puts on a treadmill just so we can assess their cardiac function and their ability to handle stress. So we've identified patients with coronary artery disease that required bypass surgery. When you use opiates, it numbs the entire body.
So what are some things that I should need to be careful of? Let's say that I am that person that you mentioned, and I'm going to try to get clean, and maybe it's a friend, or maybe it's even a program that doesn't have the medical component. And they say, okay, come on in and let's just kind of suffer through these withdrawals. What am I risking there?
There are risks involved. It's very stressful on the body. So you can see alarmingly high levels of blood pressure, even levels where you could potentially have a heart attack or a stroke. There is a lot of nausea, vomiting, and diarrhea, and you become dehydrated. That can also present great risks as far as from a cardiac standpoint. And if you lose electrolytes through the vomiting or diarrhea, it could affect heart rhythm. It's important to control those physiological responses of withdrawal. We're in a place where you can be very carefully monitored, and those symptoms can be treated aggressively to maintain, a normal blood pressure, heart rate, fluid balance, electrolytes, and can be replaced if necessary. So I think it's very important for people that have underlying medical issues that become a much greater risk during the dramatic physiologic changes that take place during withdrawal. I think it's very important for them to be closely monitored and have their physiology controlled.
Claire, you and I have talked about this before, that everybody in the life of someone who is dependent and who is using just wants to say, well, stop using, stop drinking, stop using, and everything, that's the problem. And in fact, that's actually covering up the problem, as we talk about psychologically. But in this case too, this is another example of how just stopping the usage is not the beginning of recovery or the beginning of treatment, unless I'm actually doing it in a medically oriented way. Did that make any sense? I just felt like I rambled for like a minute. Well, what I'm trying to say is we think that people just need to stop using and then they're already getting better. But you're describing that actually, no, in many ways, it starts a heavy process right there.
I think there's two distinct processes that take place with treatment for opiate dependence. You've got the or opiate addiction. You've got the dependence portion, which dependence is medical, and you stop the opiates, and it's a physiologic response. So I think it's very important to address that appropriately. I'm also a huge proponent of using naltrexone, which is a pure opiate blocker, to block the receptors, for decrease craving, and significantly reduce the risk of relapse. And that's the part that's done medically in the hospital. And I think you can't really address the true underlying behavioral or addiction issues until you've really addressed and taken care of the dependence. A large number of people do not make it through the actual detox process because they can't tolerate the symptoms. If you have a procedure or a process where you can treat the dependence and get someone on the blocking medicine naltrexone, then I think the patients have the best opportunity to be successful long term because you've gotten the dependence issue out of the way, you're blocking the cravings, and then you can really address the behavioral portion. And so that's why after the hospital, our patients go to the aftercare, which is a nice supportive environment. They're on the naltrexone. They can start to address their underlying behavioral or addiction issues.
But I think too, Michael, what White was trying to get to as well is that the withdrawal is not just stop using. Our patients that do go through the hospital, when they go to Domus Retreat, the reason we built Domus Retreat is because the physiological changes, regardless if we do rapid detox or medically assisted detox, do not stop at the hospital. So the patient can be completely off opioids, but for a few days or even a few weeks, there is a whole transition that affects them physically and emotionally.
Yes, I think you're saying that in a much clearer way than I was. I was trying to come out, but it wasn't coming out very clearly.
You're dealing with a complex human being, with a lot of different organs trying to match the speed of the detox.
What's kind of like that recovery process look like from the medical perspective?
What I explain to all of the patients is their body's used to living on these opiates. And once we've treated the dependence, then their body has to find its new normal. There are a lot of physiologic changes that take place. So the importance of having them in an aftercare such as the Domus Retreat is that, number one, it enables the patients to transition through the physiological part. So some people may have to reestablish a normal sleep-wake cycle, and we can help with that. Some people may have some anxiety, mild symptoms like restless legs. Opiates cause significant constipation. The gut has to figure out how to function normally again. So all these physiologic issues as the body finds its new normal just take time. And so that's the importance of being in a very supportive aftercare environment. And then also the behavioral part starts in the aftercare as well, where you can start to address the true underlying issues that have led to the years of opioid use. With a therapist, there's improved nutrition, to start exercising again. A lot of it is, once the opiates are out of the picture, is to be able to provide direction as to things they can do to improve their health. A lot of them have neglected just all of their underlying medical issues. So even reevaluation with their physician, some of them are under the care of a psychiatrist. Once the opiates are out of the picture, the psychiatrist can better diagnose what's truly going on, and they may require modification of their medications.
Yeah, I was surprised when I started working in outpatient substance abuse to discover how many people coming through being sober and working through our program did not eat. Like, they just didn't eat. They were out of the habit of eating, which is always remarkable to someone like me who loves eating as much as I do. But to see people have to reacquaint themselves with healthy habits, even just like ingesting the right type and number of calories to not have attending health problems. So there's a lot of things people take for granted if they haven't been through this process.
Patients on opiates also eat a huge amount of sugar.
Yes, yeah.
So all those are, major health issues that we see.
That was something I didn't think about when I worked in that place. I had a little candy dish in my office at first, and it was always empty. Crazy, right? I wonder if it'd be good to describe just a little bit about how naltrexone works. Basically, what I hear most people at my level of knowledge say is something like, oh, yeah, you take that and you can't get high. So I think that's all people really associate with it. What can you say about how that actually functions?
Naltrexone is a pure opiate antagonist, which means it blocks the opiate receptors without having any of the positive effects that you see with opiates that are used for pain. So you don't get any of the euphoria associated. And because it's a pure opiate blocker, there's no withdrawal associated. It appears that by keeping those receptors blocked, it reduces the opiate cravings and therefore significantly reduces the risk of relapse, enables the people to truly have the opportunity to identify the underlying issues. And I'll recommend that patients use it for up to 9 months. It also gives the body's neurotransmitters and hormones and all those other things a chance to rebalance. So I view it as protective, giving the individual's nervous system a chance to rebalance and find normal.
So if I'm listening to this, and let's say it's me or someone that I love, and we're, addressing this problem in our own lives, and I'm ready, I'm prepared to engage in treatment. What are some things that I should take into consideration, I guess, as I'm about to embark on that process?
Addiction is a symptom. You're looking for treatment for yourself based on your health needs, based on your emotional needs. If you're looking for detox, you have to think about your health needs. So what's good for one is not good for another. You have to seek a treatment for you, not where you're going to have to adapt to the only protocol they offer. You have to look for somebody that's A, specializes on your condition, and B, somebody that is going to tailor the treatment to your specific needs. I think most patients fail treatment because rehabs promise them, I'm going to detox you, I'm going to make your wife look prettier, I'm going to make your life greater, everything is going to be wonderful. So they're going to fail.
It's really important to pursue a treatment where they are going to look at you as an individual with all your underlying medical and psychological issues or diagnoses and individualize the treatment to you. So a cookie cutter approach doesn't work when we're dealing with opiate dependence. I think it's important for people to seek a treatment where all of the underlying medical issues are addressed and the treatment is customized to your specific medical needs, and as well as the specific underlying psychological needs, whether it include depression, anxiety, bipolar, or whatever the issues are. Customize it to the individual needs of each person.
That's kind of where I was rambling a little bit earlier, but a big part of this whole conversation that I'm taking away from it is the fact that while many people view stopping, just like I said, just stop taking that, and then all the work starts. But what our description here is that from a medical perspective, from a real treatment perspective, getting the drugs out of my system, not, just starting that one is a very multi-layered and multi-step process in and of itself. And in many ways sets you up for success or failure with all the other treatment protocols and therapies and everything you're going to do down the line. And we're going to leave it there for today. Thank you, all of you, for listening. If you have questions, please email those questions to us at info@opiates.com or @opiates on Twitter. So until we're there with you next time, remember to keep asking questions, because whenever you have questions, you get answers. And when you get answers, you get hope. Thanks again for being here.
The Wiseman Method podcast is a production of The Wiseman Method, offering medical detox and individualized treatment options for opioid dependence. Go to opiates.com to learn more. Our music is the song Medical by Clean Mind Sounds. The show is produced by Pop Collar Productions, a company where we find interesting and exciting solutions to your business goals through podcasts. Find out more about us at popcollar.net.